time is it?
Oh, it's time to go. Everyone's passing the house.
Good morning, Cindy. How are you feeling?
Good morning. I'm feeling some kind of way.
Okay, well, let's go in here and get your ultrasound started. Okay, so this might be a little chilly.
Brr, it's freezing.
Okay, you might feel some pressure here.
Ow!
Okay, this is a baby. Want to know the gender?
No. I want it to be a surprise.
Okay, now Cindy, you're 38, right?
Yes, I am.
Well, because of your age, you might want to take an amniocentesis test to make sure your baby is healthy. There are risks involved, so it is up to you.
Can I talk to Stan about it?
Of course, and you're all finished.
Dr. Maddie says that I should take the amniocentesis test to ensure the health of the baby.
Okay, let's do it.
But there are risks.
What are the risks? There's also risks of having a child, but I mean, if we're having one, so we should probably get the test done.
Okay, love you. Dr. Maddie, we decided to do the test.
Okay, so since you're since you're already at 16 weeks, you can take the elevator to the second floor and it'll be the first door on the left. Do you guys have any more questions?
No, thank you.
All right, bye. Good luck.
Nervous.
It'll be fine. It's okay. Don't worry.
Okay, so since the results are back, after looking at the karyotype, I determined that your baby is going to have Turner syndrome. I'll give you a couple minutes to talk about it while I go with the specialist, okay?
What does this mean, Stan? Why me?
Is the baby gonna be okay? I have to go to work now, but I will be back and you can call me if you need anything, okay? Hello, Cindy. I'm the genetics counselor and I'm here to give you information about what's going on and answer any questions you have.
Well, why did this happen? Is everything going to be all right? What are our options? Will our other kids get it? What will the baby look like? What other resources are available?
This is caused by the dropping of genetic information during the division of the sex cells. This means that your child will only have one X chromosome instead of two.
Therefore, your baby will be a girl.
I didn't want to know the genders.
Sorry. Continuing, this occurs spontaneously and having one child does not mean the future children will have it or have a higher risk of getting it. This is not caused by any chemical or your age. This happened when the baby was conceived.
How common is this? Will we be considered lucky if she lives?
Turner syndrome affects 1 in 2,500 female live births. 95% of all babies with this get miscarried before the first trimester, so consider yourself already lucky.
What can we do to treat this? Is there a cure?
There is no cure.
What are you talking about?
However, there are certain treatments that can fix specific issues depending on money.
Like what?
Treatments include removing the neck webbing, which you will do with a cosmetic surgeon. The baby will most likely be visually impaired, which you need an optometrist.
And you can also get a growth hormone, so she will fully grow.
5 to 10% of children will have heart problems, and 30% will have 2 heart components instead of 3, which will most likely result in heart surgery.
Cleft palate, which will require dental surgery, is also available.
1 in 3 people have kidney problems, hypothyroidism, constant ear infections, diabetes type 2, and high blood sugar.
Also, the child will be infertile, so you will need in vitro fertilization to have children.
Wow, that's a lot. A lot to worry about and a lot of money.
It is, but there's speech therapy, learning, social support, and psychological support, also family support.
How much will it all cost?
It will cost a lot, but a lot of it will be covered by OHIP or benefits if your job offers that.
So what will the baby look like?
Well, as an infant, it's going to have small, puffy hands and feet, extra skin folds on the neck, and heart abnormalities. By the time it's a teen, it'll be really small. It doesn't develop breast tissue or menstruate at the expected age. And when it's an adult, there's problems with fertility, as we said before, heart problems, and blood pressure problems as well.
So you can talk to Stan about this, and so you have the option to keep the child and have the chance of a miscarriage, or you can keep the child and deal with the condition. And there's also the choice of abortion, and I'll let you discuss it with Stan.
So what are we going to do, Stan?
I think we'll have enough money. I don't want to lose our baby.
I agree. We can do this. Okay, Dr. Maddie and Darcy, we've decided to keep the baby.
Bloopers.
So we just realized.
Wonderful. Would you like to vote? Oh shit.
Okay, wait. Okay, so since that you and Stan said that you'd like to keep the baby, I was wondering if you'd like to make following up.
Where are you going?
Just step on in here.
Will our other kids get? Didn't we do this?
Yeah, but we're just doing it again. Tell me when.
Okay, try not to look at webbed necks. Its ears will be probably lower than average. And also its nipples are going to be spread out.